So, hello, everybody. My name's Erica Saccoccio. I'm a physical therapist at Joint Ventures in Leominster. God bless you. So this can totally be interactive. I have some information to go through, but as I go, if there are questions, if more information would be helpful, by all means, just jump in. This does not have to be me talking at anybody. But just to get started here, so walking statistics. So about 48% of adults get enough aerobic physical activity to actually improve their health, which is decent, but still less than half. Walking is the most popular physical activity, and about 6 in 10 adults reported walking for at least 10 minutes daily in the last week, which again, better than nothing. But in order to get to, which we'll talk about more, kind of what the goal is a week, it's about 150 minutes a week. So 10 minutes a day is better than 0 minutes, but still not going to get you really where they want all of us to be as far as weekly exercise. Adults who walk for fun, transportation, or exercise increased by 6% in the last 5 years, which is good. And so here are just kind of like a few things that we're going to go through. So the benefits of walking for your health, your body, and your mind. Some things you may want to think about or consider if you're beginning a new walking program, or even if you're a walker anyway, things you may want to think of, things you might not know about. Also, if you're starting out, how quickly should you build up as far as your time and your distance? What can you be mindful of, and what is a good program as far as getting that going? Also, just some expectations when you start, what's normal, what's not normal, and walkability of your area, which luckily around here, I think is pretty good, and it's pretty, which is nice. And you guys have the rail trail. Does anyone walk there ever? Yeah, which is awesome. I love it there. It's really nice. All right, let's see. So again, so you can see a little bit more on here, and hopefully the slide is a little bit small, but you'll be able to read. There's a lot more as far as health benefits than I'll even mention, but the biggest one, like obviously any type of cardiovascular exercise is going to make you breathe harder, which within reason is a good thing. It makes your heart and your blood vessels stronger and work harder to supply blood to your muscles. And so that's part of the whole cycle of not shortness of breath, but some shortness of breath as you start to exercise. It decreases your risk for heart disease, stroke, type 2 diabetes, depression, and some cancers. And also kind of as a secondary effect, weight loss for sure. That typically takes longer than some of the other effects, but is also a plus. And some of the stuff you can see on there, delays aging, reduces dementia risk, kind of goes along with some of like the mind-body connection, improves mood, increases muscle strength and endurance, kind of goes without saying, lowering blood pressure, increases lung capacity, strengthens bones. So that's a big one. A lot of times people, specifically women as they get older, if osteoporosis is a concern, will say, well, I don't want to do anything. I don't want to hurt myself. I don't want to do anything, exert myself too much. But actually within reason, walking or any other weight bearing or resisted exercise is helpful for bone density, because that ground reaction force when you step down actually promotes growth of new bone cells in your body. So there is a certain amount of, you can for sure overdo it, but there's a certain amount of it that's actually helpful in maintaining and then also improving bone density. So here's where we get to kind of that 150 minutes, which sounds like a ton, but if you walked for a half hour, 5 days a week, you're there. So it's 2.5 hours a week of aerobic physical activity. They say it should be at a moderate level, no less than 10 minutes at a time, and moderate is so subjective. So we will get into a little bit more kind of how you can gauge that for yourself specifically, because, Veronica's moderate or mine or Paul's or whatever, they're all going to be different, right? So there are some more objective and some more subjective ways to check in with yourself to see, am I letting myself off the hook? Is this really easy, or am I pushing it too hard? Or am I right where I belong? Women and older adults are not as likely to get the recommended level of weekly physical activity, and walking increased among adults 65 or older, but not so much in other age groups. So here are some things to consider. You're starting out, you're not someone necessarily who maybe exercises regularly, like what are your goals, right? So that way you can kind of gauge your expectations. Are you looking just to improve mood and kind of general feel good? That's something that you can expect to improve pretty much right away. Mobility, general fitness, that stuff will take a little longer, but kind of somewhere in the middle there. And then weight loss, you got to stick with it and you'll get there, but that takes a little bit longer. So just having in mind kind of as you set out, what am I trying to do here? Are you somebody that should be checking in with your doctor before you start a new exercise program? That's not everybody, but a lot of people, which we'll talk about a little bit more. What supplies do you have or need? For me, walking or running has always been attractive because you don't need much of anything, which I love. It's easy, it's quick. You can kind of do it anywhere. But without, bogging yourself down with a bunch of junk, there are some things that are good to have with you, and you can minimize it and streamline a little bit as well. What will your schedule be? So how should you ramp up? And then also what's proper walking technique or form? So you're doing this to improve your health. Obviously, you don't want to start walking and hurt yourself because you're walking wrong or anything like that. So most importantly, to check in with your doctor or not, probably, whether you're a person who should or not. Typically, we'll go through kind of these specifics, but if you have any pulmonary or cardiac pre-existing conditions, just always smart to check in with your doctor first and just double check to make sure that there's no reason you shouldn't be doing this, or that they don't have any more specific parameters that they want you to follow. Because sometimes they may say, actually for you, like, we'd like you to keep your heart rate below X or whatever. So they say if you've been sedentary for more than a year, you should check in with your doctor. And this isn't just starting a walking program. It could be anything. If you're someone who's going to start swimming or start biking, anything that's going to be a real change from your baseline norm. If you fall into any of these categories, probably better to be safe than sorry as far as checking in with your doctor. If you're 65 or older and you don't currently exercise at all, heart condition, diabetes, high blood pressure, if you're someone who regularly experiences fainting or dizzy spells, chest pain, especially with exercise, or any other medical conditions that could make walking challenging. I think honestly, the two big takeaways are if you have any type of cardiac diagnosis or any breathing difficulty, probably smart just to double check either with your primary or your cardiologist, pulmonologist before starting. Probably they're going to say, great, go for it. But just in the event that they have any more specific guidelines. Okay, so assessing needs, like I said, this starts looking like a long list, especially when you're like, walking is supposed to be so low maintenance. What's all this about? But they're just things to be mindful of, and they're not for everybody. So you can kind of take or leave what seems important to you. Footwear is a big one, and it's very personal and very subjective. I talk a lot about it with my patients in the clinic because it does matter a lot, especially, Paul and I were just talking about that. Sometimes people just assume, well, I'm just walking, I'm not running. Why does it matter? It's still a lot of steps, and it's your body weight over and over on your feet, and it's different terrain. And if you're shooting for a certain pace, it can be really taxing on your body to try and propel yourself that quickly. Honestly, like a slow jog is easier than a really fast walk, I think, because you're forcing your muscles to work harder and harder and faster, and you don't have that force to kind of propel you forward. It's really your muscles doing all of it. So footwear, socks, water, some type of ID, visible clothing or a flashlight, trekking poles, and a map route or a plan. So footwear, like I said, super, super, super individual. There are definitely some patients that I see who say, hey, I find what I think looks good at TJ Maxx and it feels fine on my feet. Perfect. I'm not going to mess with that. Like, if it's not broken, don't fix it. But otherwise, for people who are looking for something a little bit more specific, we're really lucky. I always forget if it's in Shrewsbury or Worcester. I think Sneakerama is in Worcester, and maybe Marathon Sports too, but it's right in that White City Plaza. Anyway, they're both great. I have more experience with Marathon Sports, just as far as like, they'll watch you walk. They're going to look at your foot type, and they're going to know a heck of a lot more than I am about the specific shoe models. but really what they're doing is breaking you down into probably one of 3 categories. So if you're someone with a really high arch, you have basically you have a lot of support and you need cushion. If you're someone with a really low arch, you have not enough support and you need some. And then some people fall right in the middle, and a neutral shoe is fine for them. It also depends on how far you're going to be walking, all of that, but they're really great at watching those things. They'll watch you walk right in the store. I don't know if this is true with Sneakerama, but with Marathon Sports, you also have a month to return them after that, which is awesome. So you can walk in them for a month. It's hard to know right away. In the store, they might feel great. Then you go out for a half-hour walk and you say, well, these are terrible. They feel awful. They'll take them back. They can be as worn in as, it doesn't matter, but you've got 30 days to bring them back, which is awesome. And I've done it multiple times with running shoes. I'm like, oh my gosh, I have blisters. You have to take these back. What should I wear? So examples of these, like Saucony makes a really good one for a neutral foot, which is someone who's right between pronating into a flat foot and supinating into a really high arch. So people fall all over the spectrum. And sometimes people, when they're off of their feet, their arch might look really high, and then they go to stand and the whole thing collapses. So that's why watching someone in a weight bearing or more functional gait pattern is helpful, because to look at someone just on a table or sitting in a chair, your arch may look very different there than it does when you start putting your weight through it. Some people might go the orthotic route. They're super duper expensive, custom orthotics, and correct me if I'm wrong, but most insurances don't cover them. For patients, I make them really infrequently, custom orthotics, because I think most people can either get away with a really good shoe and some strengthening exercises, or an over-the-counter orthotic, like a good one, and get around spending hundreds of dollars on a custom orthotic, because most people, not everybody, but most people don't need them. As far as cushion, New Balance and Asics make good ones. And so the one under long walks is a Brooks Glycerin, and Brooks in general are really, really structured shoes. They're most well known for shoes for people with really flat feet that need some support. So they're often a bulkier shoe. They've gotten better at not being so heavy, but they are kind of clunky sometimes for people. And then the pictures that you see up there, so those are Yak Tracks. Has anyone used them, heard of them, anything? Yeah, so they're awesome, because obviously bad weather makes walking challenging if you don't have a treadmill or want to go to a mall or something like that. And I'm sure as you get older, just that idea of a fall is scary. It's scary for anybody, I would think. But putting these on your shoe, you won't know that they're there, but they do give you a lot of traction. They have all different models of them. But they would help you on any type of a slippery surface or something like that, because they give you a little bit more grip into the ground so that your foot's not gonna go out from under you. Yes.
Do you have any recommendations on when to invest in a new pair of shoes? Like, I know runners, they say 300 miles, in terms of walking.
Probably similar, to be honest with you. And my recommendation, only because they swap models out so quickly that they can be, if you find a shoe that you love, you say it takes you a year to get to that point, you go to get them again and they don't have them again. It's like really devastating. So I often buy 2 at a time. Yeah. Because they can be really hard to find, and they'll say, oh, we replaced it with this. It's very similar. Okay. I don't believe you, because they're not the same. So if you find one that you love, I like to buy like a couple pairs of them at a time. And then, yeah, do you like Hoka's? Those are awesome. Yeah, they're a great shoe. You'll also find that, like, so Hoka's, I forget how many years ago they came out, quite a few, but like in the last couple, they've become much, much, much more popular. And going to Sneakerama or Marathon Sports or something like that, they're just so knowledgeable. As far as, there's another brand that is a little newer called On Cloud. That's another one that people have started to buy, but they're always coming out with new stuff. And also, if you have more than one pair of that same shoe, you don't have to go right from like old beat up shoe to a new shoe. You can kind of cross over for a little bit as you break one in, which I think is helpful as well, because even if it's a shoe you're used to, going from one that has 300 miles on it to a brand new one, you're still going to feel it.
My other question
Yeah.
is, I currently have a pair of Ultra.
Mhm.
It's a, what they call a zero drop.
Yeah.
But I'm looking for new shoes and
Yeah.
wondering, is there an advantage to the zero drop as opposed to shoes that have a drop? And what really does that drop mean?
So that drop is like the measurement from the heel to the front of the shoe. So if you're someone who can handle a zero drop shoe, then stick with it. Sometimes people have a hard time going from a regular shoe to a zero drop because they probably don't have like the ankle mobility for that. So a zero drop, without the zero drop, you're going to be up here because the heel is going to be built up a little bit. So it doesn't require as much what we call dorsiflexion when the ankle comes up. It doesn't, yep.
Playing pickleball. It's
On your toes.
Stop, move all the time. And a couple of times you can roll out over too. And I don't know if there's a way to stop them. To want to go that way is.
As far as lateral stuff, you mean?
Yeah.
Like going side to side? Yeah, I mean, and that goes into a whole other area where foot and ankle stability, hip stability is so important, because all of these extrinsic factors, whether it's a shoe or an orthotic or whatever, they can only do so much for you. And like, I hate when patients become really dependent on them, because you really want to have great strength, but then a great support as well, right? So the shoe or the orthotic should be helping you out. It should be a little bit of a crutch, but it shouldn't be, your body should really be reactive to those positions as well. And I think a lot of times people just get so used to and accustomed to having a shoe on all the time that those muscles really forget what to do. And that's why people will say as they get older, well, my balance is terrible. It's always been terrible. Probably it hasn't always been terrible, but it probably has progressively gotten worse. And wearing supportive shoes is great, but I really think that there's a place for not having shoes on sometimes too, like whether it's in the house or even just doing some balance exercises safely, so that those muscles in your arches and feet and ankles tell them you need to do something, like you're supposed to hold me up, because you can only rely so much on a shoe, I think, for that stuff. But the zero drop is something that a lot of people try to go right into, and they have a problem, because then you're not going to have the flexibility. But if you're already in it, you could stick with it. You'd have no problem going up from there. It's really about what's most comfortable for you. It's usually the transition into them that people have a hard time with. But if you're already there, then you're probably fine. A lot of times people don't have the calf flexibility for that, or the ankle joint mobility for that, because it definitely requires more, which is why a lot of times if someone's having, say, a calf issue or an Achilles issue or something like that, they'll put a lift in the heel, because that's going to basically build up that heel drop so that you're not constantly stressing your Achilles or stressing your calf. And then slowly they'll pull back and take the heel lift out and bring them back down to whatever their normal shoe was. But the less drop there is, the more you're stressing your Achilles and your calf. And I don't mean that in a negative way at all. It's a good thing, but it's just not for everybody. That's all. Does that answer your question?
Yeah.
Okay. Let's see. Okay. Socks, super boring, but really important. Some people just throw socks on and they're fine, and that's great. But if you're going to walk long distance or try and walk at a pretty good clip, having the double layer socks are helpful, because otherwise this layer is just rubbing against your foot. If you get the double layer, then the two layers rub against each other. So the likelihood of blisters and skin breakdown is a lot less. You want to avoid cotton just because it makes you sweat. And doesn't matter. You can buy socks that say they have some built-in support in the arch. It's really whatever's comfortable for people. Again, they're not going to hold your arch up. So is it a little bit of an extra boost? Sure. But you want to have the strength and stability and support there just intrinsically also. Water is a big one, because people don't like to drink it because it makes them pee all the time. But also you don't want to get dehydrated. So that's very personal. You got to find some happy medium there where you're not drying yourself out, but then you're not also like out on a trail and have to pee every 5 minutes. So the recommendation is to drink every mile. I would be lying if I said that I followed that. Having water with you is annoying also. So a lot of times people will just drink something a half hour to 60 minutes, go out for 2 to 3 miles and then have something when you come home. They certainly have those belts if people want to carry water with them. I don't think that's a terrible idea, but I can also understand that. I guess the rail trail has a bathroom there still, right? Do they? The porta potty is not there anymore? No.
Not at the one at Gates Road, they gone.
Oh, okay. Because that can definitely be tricky. I ran into that a lot running. I was like, what am I going to do here? And nobody wants you to stop into their bathroom. Nobody. Like I got asked to not come into Dunkin' Donuts about 4 times because I was like, I really have to go to the bathroom. No, sorry. Mostly because of COVID. I think now they might be a little bit more welcoming, but not so much then. Safety. So having some type of ID on you, let's assume nothing's going to happen to anybody, but in the event that it did, you want somebody to be able to know who you are. And this might seem overly cautious, but also a med list or a list of medical conditions somewhere on your person is useful in the event that you can't communicate that to somebody if something were to happen. You want them to be able to treat you right away and know that what they're doing is best for you as a person. And if they don't know what you're already on or what you've got going on, they're going to do the best they can, but it's going to be pretty general. Flashlight, you know, the other thing is most people are going to have a cell phone or something with them, like tape it on the back. It doesn't have to be just one more thing. Like you can stick like even a copy of your license and tape it on the back. You can stick these lists, tape it on the back of your phone case or something, just so it's not one more thing. Flashlight or reflective clothing. You can use the one on your phone. That makes it easier so you don't have to carry something. Or you could skip that completely and just have something reflective on. I ended up buying just rolls of reflective tape, and then you can just put it on whatever you're wearing. So you don't have to wear a vest or put on some additional clothing. And then just anything bright to help with visibility, especially if you're walking on the road, because as we all know, people aren't always paying attention. Here's one of my favorites. Do any of you guys use trekking poles? Anybody? Yeah. I think that they're great. Yeah, I think they're awesome. I mean, I see them a lot less walking on the road than like out on a trail or something like that, but they're not just good. They are helpful for balance, but they're good for a ton of other reasons. They really get your arm swing going a bit more, which is going to build up more strength in your upper body. Because you're pushing off the ground, they keep you much more upright than you might be if you were walking without them. And also just by virtue of pushing into the ground and lifting, you're building up more muscle in your upper body. And then even as an adjunct, you know, they do help with balance and stability, especially on trickier terrain. But if you're someone who has a knee or hip or ankle or more than one that bother you, they do help to offload. You know, it's not obviously as much as a walker or a cane, but they really do help to take some of your weight so that walking is an option for you if maybe it wouldn't otherwise be. The other thing as far as offloading joints when it's available is like walking in water or in a pool is like the best thing because it's offloading you like 50% at least. You're walking against the resistance of the water and your joints are offloaded. So all the things that hurt walking on land are probably not going to feel like that walking in water. Mapping a route or a plan. I use Map My Walk or Map My Run a lot. It's a really easy app on your phone. Strava is another one. I haven't used it, but I know a lot of other people do. But then you know exactly where you're going. You know how far it is. Before all of these things, I used to write the directions on my leg or on my arm because I wouldn't necessarily have a phone with me and they didn't have these apps. So I'd say, you know, turn right on whatever so that I knew where I was going. But now they'll tell you where to go, which is great. So always walking towards oncoming traffic because nobody pays attention. So at least if they're not paying attention, you'll see them and you can hopefully hop out of the way. If they're coming up behind you or you're trusting that they're not going to swerve off the road, which. Yeah, exactly. Yeah, you can look them in the eye before they hit you, right? But yeah, having them coming up behind you, especially like if you've got, I usually will run or walk with only one head like earbud in so that I can hear a bit, but still like you can't really hear. And you're trusting that the people coming up behind you are good drivers. And I would assure you they're probably not. Let's see. So schedule and build up, like we talked about before, you want to shoot for like 5 days a week-ish. More is better. That's great. If you were to do 5 days a week for 30 minutes, that would be satisfying that 150-minute requirement, not requirement, suggestion. You always want to allow time for a warm up and cool down. They recommend 5 minutes, and it doesn't need to be formal. It's just a slow walk. And then once your 5-minute warm up is over, you start moving more into that brisk walk, moderate exercise. And then once you say cap it out at 30 minutes, that last 5, you don't want to just stop. You want to slowly, you want to do, say, another 5 to 7 minutes slowly, so that your heart, breathing, all of that kind of slowly comes back to baseline. On the next slide, you'll see that there's an example of a ramp up program. If like you're beginning, where you just do a 5-minute warm up, a 5-minute brisk walk, and a 5-minute cool down. And you do that 5 times over the week. Your body has a chance to kind of acclimate to that. And then each week you increase the brisk walk by 2 minutes, working all the way up to 30. They say that a brisk walk is about 3 to 4 miles an hour, or a 15 to 20-minute mile. For anyone who walks, 15-minute miles are very fast. So that's really hard. So you've got to find something that's comfortable for you, which is kind of where I come to. Do you want to look at your pace, or do you want to look at how you feel? So we use in the clinic, I'll use a lot like an RPE scale. So on a scale from 0 to 10, how winded do you feel? Again, that's pretty subjective, but if you feel like you can monitor that pretty well yourself, like you don't want to be a 9 out of 10. That's not safe exercise. You want to be like a 6. Like I can still talk, but I'm starting to get winded. I can feel myself working. It's not like walking to and from my refrigerator. I'm working harder than that. And if you really want to get into the specifics of it, you can calculate a heart rate that you're targeting for. So for anyone who uses an Apple Watch or a Fitbit or something like that, I can write this one down. It's not on a slide, but it's the number 220 minus your age would be kind of your max heart rate. And then to be in that moderate range, you want it to be 60 to 70% of whatever your personal max heart rate is. So that would kind of be the goal. Those are also numbers that if you're someone who wants or needs to check in with your doctor, just bounce them off of your doctor, but that's what they recommend as far as a moderate exercise. Yeah.
Breathing.
Mm-hmm.
Breathe in through your nose, or when you walk fast, you get your mouth open. What's the routine?
It depends on the person. I think that a lot of times people can't change that really so much. I think in through your nose, out through your mouth is the best. But people are the bigger concern on my end is where the air goes once it gets into your body, not necessarily how you're getting it in. Like you'll see a lot of people breathe just like this, which is a common breathing pattern, but you want that air to get down into your body, right? You want to be a belly breather. I even work a lot with patients on back breathing, which is like next to impossible unless you squish your stomach. But you want that air to get into your body. You want your rib cage to expand. It's, up here, this is why so many people have got all this tension up here, because every breath is like, so these muscles are really, really tensing up. Whereas you really want to take these big expansive breaths that go forward, laterally, out the back if you can. So I think that that's more important probably than how the air gets in there, to be honest with you. But that's also something that requires attention and work. It doesn't come naturally to me anyway. But
do you recommend or not recommend doing interval kind of some of the walking plans that include doing HIIT interval?
You certainly can. That will burn more calories because your heart rate is going up and down. And then when you do that, you're basically just having like a mini cool down in between those higher intervals, which is great. And again, it kind of goes back to what are your goals, right? So if you're walking for mental health, no, I don't know that that's going to matter. If you're walking for fitness or weight loss or to improve your aerobic capacity, yeah, that's a great way to do it. And you can kind of use those same numbers, right? So you're still not trying to necessarily go much above that 70% threshold because you're not trying to get into performance heart rate. You're trying to get into like a good, moderate, difficult, but not impossible level, which is typically around that 70% of your max heart rate. And then you'd want to let it, having an Apple Watch or something like that in that situation is really helpful, because those are easy to do on the treadmill, but they're harder to do when you're doing it on a trail or on the road. But if you've got your heart rate to rely on, that's a lot easier. I'm much more objective than some of this stuff allows for. So I like myself to have a number or a target. So sometimes just the feeling for me is not, I can't gauge it very well, or maybe I'm lazy, or maybe both, I don't know. But having a number, I feel like, is helpful. And the treadmill does that for you, but otherwise keeping an eye on it on a watch or something is helpful. This slide just shows what you guys have on yours, which is kind of that 12-week, going from 5 minutes all the way up to 30. And you can certainly go beyond that. It just brings you there. And once you get to that 30, your baseline fitness level at that point is pretty good, and you don't need to increase in 2-minute intervals, increments from there. You can go up more than that at that point. What to expect. So we talked a bit about blood pressure decreasing, weight loss, increased strength in leg muscles and or arm muscles, depending on your arm swing and depending on whether you're using poles, and endorphins, which are those feel-good chemicals, which your body just naturally releases when you exercise. That's the type of response that you're going to notice right away. The other stuff can take a little bit longer as far as strength and your fitness level. Walking form, that looks different for everybody. And this is a target. It's not, whenever I ask people to have their ears stacked over their shoulders, they look at me like I've got 3 heads, because nobody really, nobody walks like that. But the goal is in that direction, right? So all of the muscles along the back side of your body are not intended to pull you out of this position. They're intended to hold you neutral. So when we let our heads hang forward or our torso hang forward, all of these muscles along your back and your neck have to work far harder than they're meant to work to constantly try and pull you up. What they're meant to do is we hang out somewhere in that neutral space and they hold you there. They're postural muscles. When they get irritated and strained and go into spasm is when they're constantly trying to bring you up here. So maintaining somewhat of an upright posture is really helpful in not overloading those muscles and irritating them. Shoulders down and back kind of goes back to the breathing one too. So a lot of times people end up here. A lot of runners end up here, can do the same thing when walking. You really want those shoulders set down. Arm swing should be pretty free. Some people will do it more aggressively than others if they're trying to or not. But again, it shouldn't be limited. It shouldn't be this kind of thing. It should just be, your arms can move so that they move reciprocally with your legs. Engaging your core, again, is one that I'm not ever asking someone to do a pelvic tilt and walk around like this. Usually people are like, what? I can't walk around like that. That's never the intention. The intention is just to engage those muscles just enough so that your back and your torso feel supported, right? So instead of falling completely out of that and being here, I'm just tucking under just enough so that if I were to go to reach for something, my back has support. Same thing with when you're walking, you're rotating and your back needs to feel supported. So those core muscles should be working just enough. It's not like you're trying to do a crunch and walk at the same time. Heel toe gait is just that. That's how most people walk. It's not how everybody walks, and it's definitely not how everybody runs. So that I have the same philosophy with that. If it's working, leave it alone. Don't try and change your gait. There's no reason to do that. There's no right gait. Some people heel strike really heavily. Sometimes you'll read stuff that says that's a problem because the ground reaction force coming up through your leg is higher. That's true. But if you're not injured and it feels fine, it's fine. You're just going to end up with a shoe that meets your needs. Some people hit with their midfoot, so they do less of a heel toe gait. They kind of land with a flatter foot. There's nothing wrong with that. And then some people land right with the front of their foot. Again, nothing wrong with that. It's, if it works, leave it alone. It's only when patients come in and they're having an issue with running or walking that I would nitpick their gait and say, let's try and change this because this is why this is happening. Takeaways, slow build up. You can jump in anywhere in the middle of that program. You know, if you say, oh, like I typically walk for 15 minutes or something, hop in the middle, and then you can build up from there. Checking in with your doctor if you're someone who should, and then just figuring out what that proper equipment is for you. And it might be 2 of those things, it might be all of those things, but just things to think about to say, like, could this improve my experience? And have fun with it. It's not supposed to be awful. And this is like the best time of year to walk also. It's my favorite. And that's all. So the other handout, there are just some basic stretches. I prefer people to do those slow, prolonged stretches after exercise versus before. The 5-minute warm-up is sufficient for a warm-up before you walk. You're replicating what you're going to ask your muscles to do, right? So you're walking slowly, getting blood flow to your muscles, warming them up, and then you're going to ask more of them as you speed up. If you start off with like a slow, prolonged hold stretch, and then you go, so I'm stretching my calf, and then I'm going to go ask it to fire quickly when I walk, you're not setting it up properly for what you're going to ask. But after you walk and you've asked it to fire a bajillion times over that walk, a nice slow hold is great. So that handout is, I think it's 2 calf stretches, a stretch for the front of your leg, a stretch for your hamstrings in the back of your leg, and then one for your hip. A good 30-second hold is great. Even longer than that is great if it feels good. Those are not ones that you can overdo as far as how frequently you do them, but you can absolutely overstretch and pull too hard. They should not hurt. It should feel like a moderate pull. If it's painful, you're doing too much. And that's all I got. Does anyone have questions? Anything we didn't talk about? Yeah.
I may have missed it, I came in late.
Yeah.
Did you talk about footwear as far as my weakness? A lot of shoes. So and running.
Mm-hmm.
It's not walking. Is it really different?
Though you can walk in either of them. It would really be like, you don't want to run in a walking shoe, but you could walk in a running shoe if you wanted to. It's really going to be more specific to the build of the shoe and whether it's right for your foot and your gait pattern. And the biggest thing that comes down to is what your arch looks like when you're standing up. If your arch totally collapses when you're standing up, you need a shoe with some amount of support and structure. If you have a really high arch, you already have structure. You need some amount of cushion so that when you land on that foot, you're not coming down on this rigid arch all the time. You've got something to cushion that a little bit. So those are 2 ends of the spectrum, either end of the spectrum. And then right in the middle are, the lucky people with a neutral foot who can kind of get away with anything, but most people are one or the other. Yep.
I hate to be a pain
No.
about shoes, but it's a lot of money.
Yeah, it is.
So, I'm an old lady now, my knees hurt pretty much all the time, some days less than others. Does that drop matter in terms of stress on your knee?
It can. You would definitely want a good supportive shoe. Yeah, it can. It depends on how. I would almost want to look at your gait to see how you're walking with those on. Something like that where, with the 0 drop, you're going to be less likely to heel strike heavily, which would be a good thing for you because you'd be relying a little bit more on your calf, and that would give you a little bit more push off versus just having that force going right up through the leg. So I would think that if anything, it would be a good thing, but as long as there's enough cushion would be mine. And also I'd want to look into more like, is the breakdown on the inside of your knees, outside of your knees? Not sure. That would matter too, just as far as how the shoe's lining your foot up. Because if it's a shoe that's allowing you to fall in a lot and you've got a lot of breakdown on the inside of your knee, you'd want something that's going to hold you up a little bit better, so that you're not constantly stressing that same part of your knee. But footwear can be helpful. Strengthening can also be really helpful. It's not ever going to change what's happening in your joint, but it can help alter the alignment enough so that you're alleviating pressure from the surfaces that are most broken down. My dad has always said, like, you know, he has some arthritis, and every time he asks me a question about a knee or a hip, he's like, well, you can't do anything about it. I have arthritis. And I'm like, no, you're totally right. I can't do anything about that. But if you strengthen and support your joint a little bit better, it will feel better. It'll look the same. Your x-ray still looks terrible, but it will feel better. No. So we're there. That's where we are on that one. Yeah. Mm-hmm. Mm-hmm. Yeah. Just for day to day. Yeah. Yeah. You definitely, for anything where you're going to be doing, you know, mileage or increased steps, you want something that, depending on your foot, is supportive and or a cushion, because it becomes more important the more steps you're putting on them, for sure. But I like the transition, because also changing out of a Brooks shoe is going to be a really supportive shoe. Changing out of that and into those for day-to-day walking is great, because those are going to force your foot and ankle to work a little bit harder so that you're not, you know, fully reliant on the shoe. Uh-oh. Okay. We'll ignore it. Yeah.
On that same note about knees, I remember reading somewhere that if you lose 10 pounds, it correlated to like some higher number of impact on your knees. 20 pounds was like 50-pound impact on your knees. There was something like that. So it wasn't the same ratio. If you lost 10, it was 10 pounds less impact. It was a higher.
Yeah.
So it was always good to think about that also.
For sure. And I don't know the specific numbers, but the problem people run into when they have breakdowns, say in their knees, and say they have 50 pounds to lose, it's like, how do you lose that weight when you have breakdown in your knees and you can't walk, right? So that's when a lot of times walking in a pool comes in handy, bike can come in handy, swimming, anything where you're offloaded, because you can still get then good cardio exercise without just continuing to pound on these joints that already hurt. And that is like a really common cycle that patients are in. It's like, oh, I need a knee replacement, but my doctor won't do it until I lose 40 pounds. But how do I lose 40 pounds when I can't walk without pain, right? Which is a legitimate hang up. And so that's where even some of those, just the pedalers that you can use just sitting, those can be useful. But walking can be tricky when you've got joint breakdown, because you are obviously increasing the load through your joints. But footwear is important, strength is important. Both of those things can help support your joints. Anyone else? Good? Yes. Down your shin. I would use one like where you're pulling back this way. However, I will say that it's very rarely that it's that muscle that's the problem. I bet you a lot of money it's your calf that's the problem, because these muscles often, the muscles in the front of your shin get tight because they're repetitively pulling your foot up against a really tight calf and they're working too hard. So this muscle is hard to stretch. I often manually work on it to loosen it up, but to really get to the root of what's causing it, I might also stretch your calf. Because it's just a tug of war between your calf and that anterior tib muscle. And oftentimes, especially if you're a walker, you're going through that motion over and over and over and over and over. And if that muscle is constantly struggling against tension, then it feels tight, overworked, irritated. That's it. Awesome. Thank you all so much.